The World Health Organization plans to meet for a second day before deciding whether the ongoing coronavirus outbreak is a public health emergency of international concern.
The priorities right now, notwithstanding the deliberations of the committee, the member states affected have implemented a number of control measures. These have focused, and WHO agrees, the primary issue is to limit human-to-human transmission.
The death toll from the new strain of coronavirus continues to climb, and with the busy Chinese Lunar New Year starting January 25th, officials expect it will be difficult to contain the pneumonia-like illness. On Wednesday, authorities in China announced plans to freeze transportation in and out of Wuhan.
What they're doing is a very, very strong measure and with full commitment. So, based on the situation, taking the action that they think is appropriate is very important. We stress to them that by having a strong action, not only they will control the outbreak in their country, but they will also minimize the chances of this outbreak spreading internationally.
In the meantime, workers in the U.S. are still conducting screenings in airports and on planes to check travelers for fevers. This video is on a flight from Shanghai to Chicago O'Hare.
The airline, they told us there's 2 people sick and they need to go down the plane first.
They have to go through the screening process after they take off and make sure you don't have fever or cough or those kind of sickness. We need to make sure we are safe here in U.S.
The CDC is screening at the 5 U.S. airports that receive the most travelers from Wuhan, China: LAX, JFK, San Francisco International, Chicago O'Hare, and Atlanta Hartsfield Jackson International. Officials say they've deployed more than 100 extra workers. As of Wednesday, they were rerouting flights from Wuhan to the airports with screenings.
This idea of funneling means redirecting, reissuing tickets. So all the arriving passengers from Wuhan would come into the airports that we can surge this capacity at.
Other airports have also been put on alert, like Washington State's SeaTac, where the U.S.'s first coronavirus patient traveled through. CDC officials say they're focusing on passenger education in English and Mandarin in addition to health screenings. Officials still don't know the exact source of this coronavirus or how easily it can spread from person to person. For now, the CDC says the impact and risk of the coronavirus in the U.S. is still low.